Can you bend as easily as you once did? Do long car rides make you feel stiff? And rising in the morning, are you able to spring out of bed? Or do you ache and groan getting up? Unfortunately, these are signs of aging and very likely involve arthritis. For there are few human beings who don't suffer from it by the age of 40. There can be sharp shooting pains as well as aching or throbbing. Arthritis affects the cartilage and tissues between the bones. It can sometimes feel like the bones are grinding against one another. Inflammation of the connective tissue, cartilage separating the joints, and ligaments holding the bones together usually causes most of the pain. While osteoarthritis could be considered the wear and tear of joints, there's another form of called rheumatoid arthritis. This second form normally occurs when the joints are attacked by an autoimmune disease. Depending on the severity of your condition, we're confident in our ability to help not only with pain management, but with inflammation reduction and tissue repair and regeneration through regenerative medicine. In the United States, osteoarthritis is the leading joint disorder, back pain being the biggest problem in the U.S., and it usually involves arthritis. Thanks to aging, our diets, sedentary way of life, and obesity, we are the most obese nation in all of the developed countries. The problem is only expected to get worse unless we develop a health maintenance attitude and commitment rather than wait until it becomes symptomatic and then to try to handle it. It usually cascades into an ever worsening condition by then, requiring more serious management and treatment. When it comes to joint arthritis, there are several causes and factors that worsen the problem. This includes old age, knee injuries, bone density, weak muscles, repetitive joint use, obesity, joint laxity. It affects men and women equally. There are means in regenerative and integrated medicine to prevent pain and reduce the risk of osteoarthritis by altering these factors. I should note that aches are a normal part of life after long days and exercise. So how do you know when the problem is more severe? Is the stiffness more noticeable after long periods of inactivity or after waking? Do you have swelling? This could be a buildup of fluid. Do you experience a sharp shooting pain or perhaps a dull ache for prolonged periods? Have you lost range of motion in a specific joint? When applying light pressure, does the area feel tender or sore? Does it feel as though the bones are rubbing when the joints are moved, grating or creaking? Is there pain upon movement, worsened after you've been sitting or immobile for a while? Is there stiffness and restriction of motion? With any of these symptoms, or a combination of many, there may be a more serious underlying problem. If you see a doctor for this problem, the odds are that you will be prescribed an anti-inflammatory and a painkiller. This is American healthcare, alleviation of the symptoms by drugs or by invasive surgery, rather than handling the source. It's actually a disease treating or maintenance system rather than curative. Some may recommend adjustment of your lifestyle if it is contributory to your condition. Proper food nourishes the body, including the joints and all body tissues, and the quality of the food determines how well fed your body parts are. Exercise moves the joints, causing nourishing and lubricating fluids to reach the joint and keep it healthy, cleaned out and well fed. So proper diet and exercise is vital. When the pain and discomfort is so severe, medical doctors may recommend surgery. The present state of American healthcare is alleviation of symptoms by drugs or by invasive surgery, rather than handling the source. It is actually a disease treating or maintenance system rather than a curative. We believe in getting to the source of the problem and curing it, not just treating it, without drugs or surgery, except in ultra-serious conditions of intractable pain. We have in our integrative clinics a means of determining the real cause of your ailment, a drug-free means of treating it without surgery unless totally needed. First, we have our adjustments that usually reduce pain or use bracing to remove the pressure from the damaged or injured part. Then we will do regenerative therapy with umbilical cord stem cell, rehab, chiropractic, and trigger point therapy to help heal and regenerate the injured area. If we take stem cells as an example, These cells can reduce inflammation and therefore deal with the effects of osteoarthritis rather than give anti-inflammatory drugs. Inflammation is the way the body heals itself. Once stem cells are injected into the affected joint, it could help to form new cartilage and therefore provide the cushion the joint needs, thus finally removing the pain and discomfort. How will a typical session go? First, you'll start with a consultation where we'll assess the affected joint. From here, we'll push toward a cause and then develop a treatment plan. As mentioned previously, we always aim for a natural solution that finds the solution of relief and resolution of the condition once and for all.